Hi, so today we will study forensic odontology, collection, examination, and then evaluation and presentation of dental evidence in legal proceedings. Legal is known as forensic odontology. These are the steps of that, and legal proceedings can be criminal and civil in the interest of justice. Histological perspectives. Father of forensic odontology is Oscar Amado. Oscar Amado is the father of forensic odontology and dental evidence of famous personality. Assassination of Rajiv Gandhi, Pakistan Prime Minister Zia ul Haq, Nirvaya case Abhit, which is presented by Abhit Acharya and Adolf Hitler. Main goal: personal identification and then dental identification. First we will do personal identification. If it is not present or destroyed, then we will do dental identification. Causes to rescue comes to rescue. Okay, then dental identification will comes to rescue. Antemortal dental records and postmortal dental records. Antemortals means before the birth in sorry before the death, the person do a regular checkup at a specific clinic or with a specific doctor, famous personality. So the dentist will have the records. Not even a famous personality, dentist also have the records most of the time of normal individuals also. Okay, so that's how we will take the antemortal dental records and postmortal, all know, after death. So some standard forms of has been released out American has been released out by ABFO, American Board of Forensic Odontology. Some standard forms has been released out by ABFO, and for this for antemortal dental records we use modified. For both of these we use antemortal and modified interpol forms, which is in case of postmortem forms, it is of pink colored, and antemortem forms, it is of yellow colored. We have to give forms. We have to give, submit forms for that, for doing this modified interpol forms. So these are of that colored, and then how now there could be 5 possible outcomes. Okay, positive, probable, possible, exclusion, insufficient. Positive is you get all the evidence in one place. Comparative dental records are these. You get all the evidence in one place and perfect match is present. So you can know the individual easily. Probable is high concordance but without radiograph. Possible is some concordance. Exclusion is perfect mismatch. So you can exclude that this is not the our patient. Insufficient evidence. Okay. And then dental profiling is based on race, gender, or occupation and age. So race are of 3 types: Mongoloids, like Chinese, and Indians or South Asians, like Indians, but yes. Mongoloids, Negroids, like South Africans and all, and then Caucasians, like Americans. Okay, so then the middle third of face, cheekbone, and area around the nose and mouth, we see. Okay, so yeah, like mongoloid slant or present, or anti-mongoloid slant, negroids, nasal bridge we see, and then middle third of the face, like cheekbone, around the nose, like nasal bridge, and then is flat and broad in case of negroids, and Caucasians have sharp nose and thin lips, and cheekbone is prominent in case of Caucasians, and um, you know like that. Gender or occupation. Female has less prominent features and males have more prominent features. DNA, nuclear DNA, father and mother, and mitochondrial DNA is present only in maternal inheritance. So we can guess that she's a female if the body has mitochondrial DNA. Okay. Then dental traits is and then age is the most questions come from this it is the most important, so we will study it later. And then dental traits are like metric and further divided into metric and non-metric. Metric is size and non-metric is shape, depends on shape. Okay. Metric is size, like you can measure local factors influenced by local factors. And non-metrics is a shape observe, you have to observe and includes example 1, shoveling of incisors. Marginal ridge becomes more thick, lingual fossa is more deep. This is known as shoveling of incisors, which is seen in Apert syndrome. Second, canine with two roots, canine have two roots. Okay. Then mandibular molar has four cusp. Mandibular molar has four cusp, and maxillary second molar with three cusps, and two rooted maxillary premolar is present. And sixth is carabuli trait. You all know negroids have more chances of cusp of carabuli trait. Decrease three cusp molar, less triggers and increased cases of a birooted canine, non-metric. Okay, so that's how we can judge the body is a negroid or something else, or non-negroid. 5 to 6 features usually seen in negroids. 5 to 6 collection of traits are important. Okay, then age comes. Okay, age is further divided into prenatal, neonatal or postnatal, children and adolescents, and adults. Okay, so prenatal, neonatal and postnatal. Before birth, neonatals means 1 month after birth, and postnatal means 1 year after birth. Neonatal line is present. Live birth. Neonatal line is present if the birth is live, and then it is less. It is used in cases of female foeticides, before and after birth in enamel and dentine. You all know that neonatal line is develop after birth, at birth, sorry. So if the birth has occurred, and then the baby is killed, or like that, so we can judge that it is purposely killed and not it is not a miscarriage. And then female feticides is an example of this. People do this, and it's a shame, I know. And seen all primary teeth plus first secondary molar, which is seen in all primary teeth and first secondary molar. The neonatal line is seen in all primary teeth and first secondary molar. First secondary molar, first maxillary, not maxillary, both mandible and maxillary, but first molar in secondary dentition, and all primary teeth dentition. Okay, then we have how to identify children. It is if the dead body is is of a child or an adolescent. So in case of these two, we can see eruption emergence, which is an easy case, so that not erupted, all the erupted teeth are present, which is a period of 2.5 years to 6 years in which teeth are erupting, or it is a period in permanent teeth dentition, 12 to more than 12 to second year. Sorry, this is not the period, except this you can estimate, because teeth are not erupting but have erupted. In these case you cannot do, so we will do in these case at the age of, except these ages like 2.5 to 6 years and more than 12 to 13 years, we do calcifications and radiographs tests, and except these ages we do eruption emergence, so we can identify that. And in case of and in radiograph, in in these ages, we do radiograph like Demirigian's method of age estimations, in which 7 teeth from left mandible, we count 7 teeth from left mandible, take and 8 stages are studied from cusp to apex of the root is formed. So we have to go in detail in case of these, and watch the anatomy, and study each tooth in detail and its anatomy, so that this is how we can do. So this method is known as Demirigian's, Demirigian, Demirigian method of age estimation. Okay, now adult, mainly we use 6 methods. 6 methods are these: Gustafson's method, incremental lines of cementum, which is incremental lines, also known as incremental lines of Salter, uh, dentine translucency, amino acid racemization, Qualls radiographic method, and these two are studied separately for age estimation. Okay, Gustafson method has 6 parameters: A, S, P, C, R, T. Okay, so A means amount of occlusal adhesion is present, amount of secondary dentine deposition is present, amount of PDL loss present, cementum deposition over root resorption, and dentine translucency. These 6 parameters we have to see in an adult tooth. Okay, if these all are high, means it is an older tooth, and if these, we don't have to go in detail as a need based study. Okay, you can find online if you have to go in detail, or Google it. Okay, now incremental lines of cementum lines incremental lines of Salter, it is also called as acellular cementum area. A tooth is chosen to study this mandibular. The tooth which is chosen to study this is a third molar and mandibular central incisor. Mandibular central incisor and third molar representative teeth hai. For this case, instrumental lines like mandibular central incisor and third molar, which is a wisdom teeth. Okay, if I am repeating some words, that means I am trying to remember it. Okay, so learn it with me or remember it with me. Don't see as a waste of time. Okay, that I am repeating a lot of words, because these are the things we need to remember, like which teeth, representative teeth are present. So mandibular central incisor and third molar, which is a wisdom teeth. Okay, then if any hypomineralization band is seen, like pregnancy, skeletal trauma, which helps in positive identification of the individual. Hypomineralization in pregnancy or in skeletal trauma helps in positive identification of the individual. If the body is pregnant or not. I'm regularly saying it as body, but it is not a body, but it may be a body, or it may be antemortem or postmortem. I don't know what I'm saying, but forget it. Okay, let's concentrate again. If any hypomineralization band is seen, pregnancy or skeletal trauma helps in present positive identification of an individual. Okay, then Qual radiographic method. Qualls radiograph measure different types of ratios of 6 teeth, pulpal 6 teeth, only of 6 teeth. Okay, measure different type of ratio, pulpal sizes, ratios. Example, pulp upon cementum upon root. Oh, sorry, not cementum. It is crown. Okay, so pulp upon crown upon root ratio, pulp upon root ratio, and pulp chamber upon pulp canal ratio. These ratios helps in identification of the age. This is known as Qualls radiographic method. Okay, then we have amino acid racemization. All proteins undergoing racemization. One such amino acid is aspartic acid, mainly seen in L form in young adults, and D form in old adults. Okay, bite marks. Now, McDonald definition of bite marks is impression created or left by either teeth alone or supporting structures. McDonald's classification: tooth pressure, tongue pressure, tooth scrape marks. Three categories we have the McDonald's have divided: tongue tongue pressure, tooth pressure, and tooth scrape marks. Okay, like it's abrasion. It's very tooth scrape marks is very severe. Okay, tooth pressure you have seen like in child bites in everyone's childhood. We have once have bitten someone. Okay, then positive, probable, and exclusion. It is further divided: positive, probable, and exclusion. Okay, then the shape of the bite mark: incisors have rectangular shape, canine have triangular, and premolar and molar have spherical. It is easy to remember because diagrams. Now, rugoscopy is the rugae classified study of rugae classification by Lysel. You have to remember the name Lysel. Lysel gave rugoscopy, okay, in length. Primary, secondary, fragmentary. More than 5 millimeter, 3 to 5 millimeter. Primary, in primary case, okay, it is not primary dentition or secondary dentition. It is just he has classified, Lysel has classified it in three categories: primary, secondary, rugus, primary rugae, secondary rugae, and fragmentary rugae. So more than 5 mm it is primary, 3 to 5 mm is secondary, and 2 to 3 mm is fragmentary. Okay, then in case of less than 2 mm, not considered to be palatal decay. Okay, now chiloscopy, study of lip prints. Okay, Sushi Hayashi's classification has come many times in past exams, past NEET MDS exams or in ICET. Okay, so he has classified in six categories: 1 dash, 1 2 3 4 5. Okay, 1 dash is not cover does not cover entire lip. 1 is vertical, 2 is branched, 3 is intersected, 4 is reticular, and 5th is not specified. Ameloglyphics is a recording of enamel rod patterns. Comparative identification is comparison of dentition of dead person with presumed antemortem records of individuals. Most recent method of age estimation amongst the following is a comparison of C4 levels in enamel and atmosphere. Thank you.